Indeed, it has been very informative for all of us. But still, there are a few questions, and I'll take another 10 minutes to ask those questions because we want to make the most of this sitting today. There is one which talks about children. How prone do you think children are? Since we are, belong to a school network, so children and adolescents, they have not got their vaccines yet. How prone are they? And it's good to know that we'll be getting some nasal spray for the little ones.
Yeah,
So,
thank you, Aisha. As I told you that we have applied to NBC, which is National Bioethics Committee, for the approval in children. As you know, the government has lowered the bar already for children. Now they can be injected at the age of 14 years. So I think the teenagers and children should get full use of it. Children can be infected, but generally in children, the disease is little different. Usually the proportion of children which gets very severe or critically ill is less, but at least I know of 12 children who died, unfortunately, in my hands. So children do get serious disease, and children also have a disease which occurs and then they are okay, and then after 6 to 8 weeks they get heart disease, what we call is Kawasaki disease, and their heart arteries are enlarged. So they need to be protected. They are our future, and they are the most important people in our lives. Because it has happened so dramatically in the world, that world has changed. Ultimately, I think we will be injecting these vaccines just like we are injecting measles, mumps, and rubella to infants. Pregnant mothers must also be injected. We do not inject them in the first trimester because we do not have safety data. But in the second trimester, they are being injected, and the preferable vaccine for younger children and for younger mother and for pregnant mothers is messenger RNA vaccines. So you can protect 2 lives while they are in the womb by injecting messenger RNA vaccines.
Right. In fact, Dr. Saab, that is very confidence building to know, just like we have come over with measles, mumps, rubella, and other related vaccines for the babies. So in the same way, in due time, I think we will have the vaccine for this, and the world shall, inshallah, be protected against it. Dr. Saab, next question is about vitamin D. People are asking, can we take it on our own without a prescription to build the defense mechanism?
Very good question. Ideally, I know LACAS is a privileged institute for the privileged people. So I'm sure they can have their vitamin D tested. But if we, and this is, I'm talking to the tip of the pyramid, not the base of the pyramid. In the base of the pyramid, what we are recommending during pandemic is that do not get yourself tested because it's an expensive test. Costs around 3,000 rupees or 2,500, depends upon the lab. Serum vitamin D level, that's the ideal thing for you to get. But for your servants, for your PNs, for these, we do not recommend getting the test. We say just take vitamin D, 10,000 international units daily, very minimum dose. For those of you who have suboptimal or low vitamin D after testing, you can take 200,000 units every 2 weeks, okay? And better take soft gel capsules. We have done many trials on it. My university, because I am the vice chancellor, my chancellor is the governor Punjab, Chaudhry Sarwar. I motivated him, and fortunately successfully motivated him to come up with a campaign, free vitamin D for all. So we have now a campaign of free vitamin D for all, that is 10,000 units with the pharmaceutical companies supporting us. We are doing it. We've done it in Saiwal, we have done it in Lodram, we have done it in many, many villages now, and we are camping it. We can do it in collaboration with LACAS. We would love to do it, where we will give free vitamin D just to increase the awareness. The best thing is test your vitamin D, but if you don't want to spend or you haven't spent, take 10,000 international units every day, not only for COVID, but of course in this pandemic for COVID, but also for so many other things. I can talk about vitamin D for a couple of hours, because vitamin D is important for intracellular signaling in your immune cells. That is why your immune cell malfunction occurs if you have low vitamin D.
Right. Thank you very much, Dr. It would be ideal if we can bridge this gap together and work on vitamin D with our children and your hospital. So inshallah, we will put it up to our high management for sure. Another question is for those who love pets. How prone are pets, cats, dogs, other pets at home? If the person himself or herself gets corona, are their pets also prone to it?
Well, as we all know, I told you the history, 11 December 2019, the horseshoe bat was infected by 2 viruses, and then there was a species switch, as we call it. Then from bat, it was switched to humans, and then there is human-to-human transmission. But theoretically, there is a possibility that the switch can occur again from human to animal. Fortunately, we have not documented any switch so far, but it is better to be careful in handling your pets. That means keeping the pet hygiene intact, giving them shampooing or whatever, and having their vaccination schedule on time, not of COVID, but of other vaccines, whatever. And also washing your hands while handling the pets and after handling the pets. So please do that and hope for the best. We have no evidence that, we have evidence that this species switch occur in Wuhan 2019. We have no evidence that it has occurred again, but potential is there.
Right. Thank you for that. And Dr. talking of aspirin, you say that it is a wonder drug. Do you think that people should start, just like vitamin D is something that is going to save us from corona? Do you advise aspirin on regular basis as well?
Well, to be honest, I do not have evidence in Pakistan whether it works for healthy people or not. I know if the people are low risk of heart disease, they are not diabetics, they are not hypertensive, they do not have cholesterol problem, and they exercise regularly and their weight is near optimal. They are very low risk of cardiovascular disease. We do not recommend aspirin for primary prevention. If you get heart attack, God forbid, or if you have a stent in your heart, or if you have a bypass done, you will require aspirin and maybe another antiplatelet, 2 antiplatelet forever for your life. You must be. Diabetics, they are high risk, so they should be. Hypertensive, they should be. Smokers are high risk, so we recommend them. For a person with very low risk, we do not recommend, because obviously there is harm of every drug and aspirin is not harmless. Above for primary prevention, that means first attack prevention, we do not have evidence in Pakistan. So what we are doing is A4P study. I am president of Pakistan Aspirin Foundation. We call it Aspirin for Primary Prevention Pakistani Population. A, aspirin, Pakistan, primary. I would love to enroll the teachers, the staff of LACAS on the study. This study is for 4 years, and this is going to give us answer whether we were able to prevent heart attacks or not. But theoretically, yes, if there is no contraindication and you do not have allergy to aspirin, you can take aspirin. It is generally safe, 75 milligram, and we know that it has, during COVID-19, we recommend that yes, anybody above 50 should take it during the pandemic, because I told you that people who were taking aspirin had 27% less rate of going on to ventilator.
Right. Thank you very much. And one last question from my side, and then Ms. Sumbul might have a question too. For the booster, is it required after 6 months of having both the vaccines?
Very good question again, because the booster have been allowed at the price of 1270 rupees paying to National Bank, and then you can go for the booster. As a scientist, I don't recommend it at all, because there is disparity. Vaccine acuity is a problem. On one side, we have huge population which has not been vaccinated even for once. And very little, few people have been vaccinated, completed the vaccine. So we should concentrate on vaccinating everybody and making everybody safe. As I told you, nobody is safe unless everybody is safe. So let's make everybody safe first, and then we can think of boosters. We do not have any data as yet in the world. We are the first university, first institute who is trying to bring in that data from polyvac study that I told you. And of course, Aisha, I will be sending you that link in next few minutes, and I'm hoping you'll share it with the parents somehow in this group. You'll share it with everybody who has gotten a booster or are contemplating to get it. At least they should register on that link. That will help us to help other human beings whether booster is safe or not. We don't know. We have no evidence so far whether mix and match of vaccines or vaccine shopping is a safe phenomenon or not.
Thank you very much. And I will ask my panelist, Ms. Umbul, as well, if there is any question in her mind. And we have taken more of your time than we asked for, Dr. Saab, but thank you so much. It's an interesting and very informative talk. Ji, Ms. Umbul, anything from your side? Please unmute your mic, Ms. Umbul.
Thank you very much, Dr. Saab, on behalf of the LACAS management and the administration and everyone here at LACAS. Thank you a lot from the core of our heart for the time which you have given for this enlightening session and the kind of insight which you have given for the research which is going on here in our country and the contributions from your side, from your team. It is so encouraging to see and hear that so much is being done here in our country too, and we are also going in the right direction, and the right kind of info is coming to our side also. A lot of, more of the questions being asked by Ms. Aisha, which were sent by the participants, but there are a couple of more questions which I would like to ask. There's one question which is saying that do RNA-based vaccines affect our DNA? This is more of, biological kind of a conceptual question. But yeah, this is interesting. I thought that maybe some kind of info can be given on this also.
Thank you so much. No, not at all. They do not affect your DNA. They do not have any long-term side effect potential, because as I told you, they are self-destroying in their body. After injection, they are not no more in your body after few hours. You see, they just so they are absolutely safe, and they do not affect your future generation. They whether it is Bill Gates or anybody who is trying to program you or take over you or track you through these vaccines, it's just not possible. These are all myths and nothing reality into it. They're absolutely safe. All the vaccines are safe. I am afraid of not these vaccines for myself. I am afraid of, unfortunately, dying any death, but afraid more so of dying COVID death, where death occurs in isolation and nobody's, not even my own children are there to hold my hand or pray for me right in the ICU bed, because it's a death in isolation. So it's that as a after seeing so much misery every day, I pray to Almighty Allah that it protects me and all other human beings.
Amen. Amen. Doctor, one more question. People are asking about traveling. That if you are traveling to Europe, America, or if you're traveling to the Middle East, is it true that we need a different vaccine for that particular place that we are traveling?
Yeah, Aisha, that is a very unfortunate thing. All these vaccines which are available in Pakistan, whether in the form of Sinovac, Sinopharm, or CanSino, they are all WHO approved. Now, WHO is an organization of which we are a member, and there are so many member states. All the world is a member. It is once the WHO has approved on the evidence presented to do the vaccine, it is up to them, and they should avoid this vaccine economic war or vaccine politics and vaccine diplomacy. Because America, as we all know, have been trying to downplay China throughout this pandemic. Donald Trump came up with Chinese virus and came up that it was, he went up to the extent of saying that this have been manufactured by China, this virus, without any evidence. And then when I was very hopeful that when Biden came in, that he will play more sensibly, but unfortunately not, because it seems to be a popular thing to talk about China in US to attract US people. He immediately formed a committee to investigate the role of China in manufacturing this virus and killing so many human beings. I think there is absolutely not even an iota of truth into it. And the China has produced very effective and safe vaccines, and most of the vaccines have been produced by China. We should be giving credit to China, not only that China is our all-weather friend, but also on the merits, rather than downplaying it. So it is the failure of WHO not getting implemented, and its failure of our vaccine diplomacy or our diplomatic channel, when most of the people have been injected by Sinopharm and Sinovac. All countries, this is unfair that the countries are saying, unless you inject our vaccine, we will not allow you to come into our country. So you in Pakistan, that means we will not be able to travel anywhere in the future. So this is unfortunate, but gradually, as you can see, Sinopharm, Sinovac, which is the most injected vaccines in Pakistan, and CanSino is now accepted, fortunately, globally. So it will happen. But right now, this economic war, this downplaying for each other, the unfortunate thing is happening, led by, of course, the global policeman, USA.
Sure. Thank you very much, Dr. Saab. It has been really very nice. The concluding talk again has been more beneficial. I think we've answered most of the questions, but still, if we know that now we have a link with you, and we will continue to get information on this topic. Thank you very much. Thank you everyone who has been with us for this session, and especially to those who have continued to stay till the end. Thank you to my team who has helped me with the technical things. Thank you, Ms. Sumbul. Thank you, everybody. And Dr. Saab, thank you very much.
Thank you.
Allah Hafiz.
Thank you very much, Dr. Saab.
Allah Hafiz.